Do you want youthful, glowing, supple skin, but you just don't know where to begin? You're not alone. I hear this question every day. Hi, I'm Dr. Jordan Carcaville. I'm a Mohs surgeon and cosmetic dermatologist. I'm here today to navigate the ins and outs of skincare and what's going to work best for you and your skin. So let's get into it. The first tip is to prioritize sun protection. So this means putting on your sunscreen if you're going to be outside more than 5 minutes. This is going to be if you're going to be in a car with the sun coming through the window, or if you're near a window with the sun coming through the window, or even on a cloudy day. What you want to do is reapply every 90 minutes, wear SPF 30 and above, and don't forget some of the hard to, think about areas that might be your hands, your ears, your neck, your chest, your décolleté, especially for women wearing V-necks. So prioritize the sun protection. That's a great place to start. Tip number 2, hydration is key. I can't tell you how many people's skin look older and aged if it's just dry. So you want to make sure you have a moisturizer that works for your skin. One that's going to be hydrating, long lasting. But if you're acne prone, maybe not too oily, or look for the term non-comedogenic. But moisturizing the skin, whether it's with hyaluronic acids or a thick moisturizer or even Vaseline at night, getting that moisture to the skin is going to be an easy access point to making your skin appear more supple and more youthful. Tip number 3, it's going to be using retinols or retinoids. Okay, we ask why. Well, these are hot products and they're over the counter and they're prescription. So retinoids are vitamin A derivatives, retinols and retinoids, and they basically stimulate your collagen production and they decrease the dead layers of skin and they really brighten the skin. They help with pigment too. The main thing though is using it to the point that you tolerate it. Retinoids and retinols, they're acids, so it can be irritating. So use it to an extent that you feel that you can tolerate it, but don't go so beyond it that you're irritating yourself. But these are great products, vitamin A derivatives, to help stimulate collagen and to brighten the skin. Tip number 4, going to be healthy lifestyle choices. What you eat actually matters. Good nutrition helps all of our cells. It helps our health in general. And a lot of our good health, what's inside, is manifested outside on our skin. Many times in my patients, I see more acne, more psoriasis, more eczema when people are eating more processed foods or things that inherently irritate them. In our practice, we have both a nutritionist and an expert contact dermatitis doctor who we use as resources to help you identify things that maybe you're allergic to or help optimize, what you're putting into your body. Because what we eat can truly reflect what's on our skin. Tip number 5 is to keep it simple. Maybe I've alluded to this in some of our previous talks, but we want to use little bits of ingredients that we know are going to be good for us. So we don't want to use too much of any one thing, particularly acids or other topicals that we're using as treatment. So moderation is key. We also don't want to complicate things with too many steps. The number of times I see people with allergies or conditions called perioral dermatitis or just, random nonspecific rashes. My first question is, what care products are you using at home? A lot of times there's a list or the people are bringing in bags of products. So keep it simple. If you're sensitive skin, we're happy to help you, coach you through that to what you can and can't tolerate. But you never can go wrong if you just keep it simple. Tip number 6 is avoid over cleansing. I see a lot of patients when they have acne, washing their face several times a day. Sometimes that's not good because you're actually hurting your skin barrier. You're stripping the oils away. You're making it more susceptible to injury from outside chemicals and environmental triggers. We also see this in people with sensitive skin, like eczema. We want to put moisture back into the skin. We want to protect the skin. When we wash the skin, we remove the natural oils and some of that protection that we want to keep in there. So don't overwash. Once to twice a day is plenty. And then tip number 7 is to focus on your gut health. This probably segues a little bit into those healthy lifestyles, We do have a nutritionist on our staff, and she really helps our patients navigate the ins and outs of good nutrition to get probiotics, antioxidants, and to just really keep that gut healthy without a lot of processed foods. So, by maintaining good, healthy lifestyles, we hope that your skin will also manifest that. Remember that skincare is a journey, and it's going to be all those details, all those small habits, all those changes that add up together to create that great outcome for your skin. If you found these questions helpful, then please feel free to subscribe to our channel. If you have any questions and you want to chat about anything in more detail, feel free to drop in those comments below. Thanks so much.